There's always the, did she get that job, because she deserved it? Was it just handed to her? Does she have the qualifications?
Racism dogged Dr. Kona Williams throughout medical school, following her even after she got her degree.
It happens every single day. And I think that needs to be realized and taken seriously before we can move the next step as to what do we do about it.
Systemic racism also affects patients, a reality graphically captured last year by a Quebec First Nation mother. Joyce Echequan recorded medical staff mocking her as she lay dying. Echequan's death prompted high-level meetings today and yesterday between government officials and Indigenous health experts.
There has to be a transformation of power.
That transformation will come in the form of legislation. Consultations are starting to hand over the delivery of health care to First Nations, Inuit, and the Métis Nation. The goal is to create Indigenous-led health authorities, hire more Indigenous health professionals, and make Indigenous patients feel comfortable seeing nurses and doctors.
We need to define the quality of healthcare to include cultural safety.
This law professor recently found widespread inequality in a review of BC's health system. For instance, Indigenous women are screened only half as much as non-Indigenous women for cervical cancer.
This is not advocacy, this is facts. We need to bring those levels up.
The federal government is spending more than $15 million over the next 2 years to develop Indigenous-tailored health legislation. But a bill isn't expected anytime soon. Talks are expected to take months. For some, the pace of change is frustratingly slow. Olivia Stefanovic, CBC News, Ottawa.